Welcome to the Vegan Pulse, the podcast that brings you the stories of compassionate individuals from all over the globe, sharing their personal journeys into veganism and their current efforts to promote this ethical lifestyle. I am your host, Nancy Arenas, and today our guest is Dr. Allan Kornberg. Dr. Kornberg is a pediatrician, healthcare and charity executive, and medical director of Balance.org, which is a public health and nutrition advocacy organization campaigning for healthier menus in schools, hospitals, and other critical institutions. Allan is committed to nutrition as medicine, particularly whole food, plant-based diets, in optimizing health and preventing and treating disease. Let me introduce him to you. Hi, Dr. Kornberg. How are you?
Very well, Nancy. A pleasure to meet you here. I'm doing very well, thank you.
Pleasure to meet you as well, and thank you for being on the Vegan Pulse. Now, can you tell us about your journey into veganism?
Yes, no, I've been a vegetarian for about half of my lifetime, and I've been vegan for over 20 years. Of course, as you can see from my gray hairs, I have a lot of years, and so for me, it was really, my motivation was really initially entirely ethical. It was all about compassion for animals that are raised for our consumption, that suffer, horrible, miserable lives in factory farms and are then slaughtered. And so I had moved from being vegetarian to vegan, on that basis as well. Over the years, because I'm a pediatrician, I'm a physician and a pediatrician, and so I'm well aware of health and medicine and science. And so it became clear to me that plant-based diets are healthier, and like any diet, one needs to pay attention to particular nutrients, which is true for any diet. But so for that, in general, plant-based diets reduce the likelihood of heart disease, of type 2 diabetes, some cancers, obesity, and so on. So I began to be more and more engaged on the health side as well, after I started from a purely ethical side. And so it really is an overlap, a total alignment of ethics and compassion and health, and also the environment and carbon. It all aligns towards plant-based diets.
Absolutely. And as a pediatrician, have you noticed how children are becoming more and more ill? Like there's more diabetes cases, more obesity, kind of a thing?
Yeah, absolutely. It's been one of the challenges in pediatrics around plant-based diets, are that most of the harm, of course, we all care about our children to have healthy lives for the next 70 or 80 years, but we don't see a lot of the disease that older adults suffer from. We know about it, but we don't see it, and it's not on our radar screen as much. But in the last generation, it's been extraordinary, really, especially in adolescence, about the amount of obesity and type 2 diabetes. When I trained in pediatrics, we used to refer to childhood and adult onset diabetes, because children and teenagers didn't get type 2 diabetes, or very, very, very rarely. And so but now we call it type 1 and type 2, because the quote unquote adult type is very common in teenagers, and it's highly correlated with obesity. So yes, absolutely.
And so let's talk about the medical director at plantbased.org. And so let's talk about that.
So yeah, so I work with a number of charities, primarily on plant-based nutrition and diet change, and also straight up animal protection. I'm the medical director with Balance.org.
Balance, right?
And so Balance works on institutional change around having schools, hospitals, universities. We work with Buddhist temples. We work with any institution around having more and more plant-based choices. We work institutionally. We support individuals around their advocacy, locally, in terms of having more plant-based choices. And we work on policy at a state and national level on having plant-based foods be more accessible. One of our biggest, most important campaigns is about fiber. Fiber is an absolutely key component to healthy diets. Most everybody knows that, and so Balanced is working very hard on um, on fiber and having more fiber was almost the great majority of Americans of any age, and really people around the world that eat Western diets are fiber deficient. So I support all that work, and then I am leading a program called Nutrition for Families, which is all about plant-based nutrition from pregnancy, or really preconception through adolescence, with a particular focus on children. And so we have materials and resources both for families and for pediatricians, family docs, nurse practitioners, dietitians, and others that care for children. And we partner with both like-minded organizations and some of the national professional organizations on plant-forward type diets.
Yeah. And let me just apologize. You are the medical director of balance.org. I'm sorry. I have plant-based, every time I get a chance to say plant-based, I'm just out there. So you're the medical director of balance.org.
Yes, balance.org.
And I was looking at the website where you have plenty of resources, not only for individuals, but for institutions, which I think is so important to get schools on board and hospitals on board, especially hospitals who are supposed to be taking care of your health.
Absolutely, it's been interesting, and we're making progress. It's all incremental, and from a hospital, and so hospitals of all places, as you say, someone, and also the staff and visitors, the cafeteria, as well as for inpatients, someone just had a heart attack, and they shouldn't be, in the cafeteria, or certainly in the inpatient service, eating, red meat with a baked potato with lots of sour cream, thrown on top of it. It's almost ironic, and so both, as you say, both in terms of the immediate impact on health, and then also is communicating the message to health providers, to visitors, to families, to patients that, hey, nutrition. Food is medicine. It goes back to Hippocrates, who said that food is medicine. Healthy nutrition is amongst the most important ways to stay healthy and to mitigate disease. And so we want to communicate that at hospitals, also schools, universities, other institutions, but hospitals especially. Absolutely.
Yeah, and so what happens is that I feel is that because we've been kind of brainwashed since we were young by the meat and dairy industry about, milk is good for the bones, and, you have to have your protein from, red meat and stuff like that. That is really sad that this continues on.
No, very, very much so. It's the amount of without sounding cynical, the amount of money that's from industry, from animal agriculture industry, as you say, from the Cattlemen's Association, from the dairy association, the dairy farmers, and so on, is extraordinary. I was quite surprised. I don't get shocked very much. It was about 10 years ago, and the in medicine, in education for physicians, in peer review medicine, continuing medical education, we're all obliged to disclose any conflict of interest. And it just makes common sense, ethical sense of any sort. If you're doing a study about drugs and you're being supported by the drug company, you need to disclose that. And so I was doing a little bit of work around the American Academy of Pediatrics, our professional association, and I've been a proud member for 40 years. So, and so I love the American Academy of Pediatrics, but it was about 10 years ago, and I was doing a little bit of work aligned with AAP around iron and toddlers. And there's this misnomer that if toddlers are not eating, a lot of red meat, they won't get enough iron. And the continuing education within the academy about iron and toddlers was supported by the Cattlemen's Association, which was just for me shocking. And I've been around long enough. I don't get shocked very often. So that's changed, but still, it speaks to how pervasively this the entwinement happens around industry and money and influencing these sort of matters.
Yeah, and I was just seeing that I just opened a piece of mail, and they were doing a cancer event here, helping for cancer. And the main sponsored, I'm not going to say the name of the company because I don't want to promote them, but it's a meat, a hamburger joint. And I'm like, what is it? You're not connecting the dots, it just people need to speak up, and and we have to tell them this.
Yeah, no, and of course, companies like to, wrap themselves in good causes and charities, in terms of, maybe a little bit of do-gooderism, but it's really to promote their brand. And so, for example, McDonald's for many, many years has supported. It was a really wonderful charitable effort. It supported Ronald McDonald houses for the families of children suffering from cancer that are at a tertiary, referral center and are far from home. It's a lovely place to stay, and pro bono, for free, and it's wonderful. But it's McDonald's, and all the and of course that so yes, what you say, yeah.
And for me, myself, I believe that like restaurants and different institutions like schools and hospitals need to step up and kind of move forward and start doing the right thing by promoting more plant-based, whole food diets.
Absolutely, it's all about health. It's about choice. We understand that all change, including here, happens incrementally. So we're not telling schools and hospitals and universities and other institutions to go 100% plant-based tomorrow. That's not going to happen. We want there to be, as you say, more plant-based choices. An important intermediate staging time would be plant-based by default. So the plant-based choices are front and center, and the meat is sort of stuck in the back on the menu, or physically if it's a buffet. And that we have change over time. We also describe plant-based meals as adding to choice. It's not taking anything away, it's adding. And of course, we're very sensitive to inappropriate about ethnic choices and ethnic cuisines. And for many immigrant communities, coming to the U.S., both from East and South Asia and from much of Latin America, while not entirely plant-based cultures, a much higher percentage of plant-based choices come to this rich country, and within a generation or so are eating, tons and tons of red meat and other less healthy choices. So we as you say, and we aim to align with community choices and community culture.
And the fact that you just mentioned culture and ethnicity, I haven't had my second cup of coffee yet. You know what I'm saying? That I myself am Hispanic, so I grew up in Brooklyn, New York, and in a Spanish household. And I just want to say, when I went vegan, I still have not missed any of the foods that I was eating prior to being vegan. I just took the cruelty out and the unhealthiness out, because I still eat all the same foods that I ate before.
It's very true, and it's all you say. I also, of course, I'm 2 hours later than you, so I've had my coffee this morning, and I can also mention just that coffee in moderate consumption is actually quite healthy. So people shouldn't worry about a cup or two of coffee a day. I grew up in Brooklyn, also in Canarsie,
Oh,
and the our former borough president, Eric Adams, of course, now is the mayor, and he is vegan himself, and he is a strong proponent. He has worked very hard, and it's been wonderful to see. And the New York City Health and Hospitals Corporation, these 11 huge hospitals like Bellevue, are having more and more plant forward choices, and thanks to the mayor and his people. So yes,
definitely. I'm very proud of the mayor, Dr. Eric, because he has done a lot in a short period of time, and other mayors across the country should do the same. I
and
mean,
he's doing some, yes, and he's doing some work to with the mayors, the National Mayors Association, to encourage that. And it shows sometimes when people say to me, is a grassroots effort or a top down effort, more effective? And so my answer is yes, because they both matter. And so those of us working in the trenches, that's wonderful. But if somebody in a high position, is totally committed, and for the good mayor, his honor, it's started with health. That can make huge change. It's wonderful. It's great to see.
and he's working, and by doing so, he's actually working for the people, because he's trying to make them healthier, have a better planet to live on by doing all these efforts that he's doing. So kudos to Eric.
Yes, to
And
Mayor Adams. Kudos
yeah,
to him, very much so. He's helping his constituency. What more can you ask? Yeah.
yeah. So, any other things that you want to let us know about?
I would just reemphasize and add that plant-based diets, ultimately vegan, but plant-based or primarily plant-based diets are healthier. Every diet requires paying a little bit of attention to. And so, if you live in the north, for all diets, you have to make sure you get vitamin D in the winter. People on plant-based diets need to pay attention to B12, and most of us should take a supplement. Other than that, I can spend an hour talking about the various micronutrients. I'll spare you, and we don't have the time. But every diet has some nutrients are easier, some are harder to come by. In general, plant-based diets are healthier. Some people change like that, and some people change incrementally. If you begin to have more plant-based diets, for your family, you're helping every member of your family live a longer and healthier life.
And one other thing that some people think, I feel fine right now. They're eating they're flesh eaters. They're eating the SAD diet, the standard American diet.
Yes.
And they think, oh, I'm doing fine. But the problem is that they don't realize that all this thing that they're consuming will come out, eventually, and will hurt them. It'll show up as cancer, diabetes, heart disease, and all those things.
Yeah, there's no doubt. I mean, individual basis, some of us live longer than others. On a population basis, just playing the odds. If one eats a plant-based diet and one eats a vegan diet, or at least a predominantly plant-based diet, one is likely to live considerably longer and healthier. Not only more years, but healthier years, more years that we can enjoy. And within a family, of course, it influences and affects the whole family. There's very briefly, there's about 6 areas around the world called blue zones. One is Loma Linda, California, which has a very large Seventh-day Adventist population. Many of Seventh-day Adventists are vegetarian and vegan. Okinawa, Nicosia and Cyprus is a Greek island, and so on. And so people live there on average in blue zones at least 10 years longer. 10 years from a population basis is shockingly long. And many more centenarians, people live to be 100 or more, and people live healthier. And so while there are some other factors as well, good exercise and social connection and all of that, the most important attribute that we see across blue zones are that many people there are entirely plant-based, and the others are predominantly plant forward, mostly plant-based, or at least a Mediterranean-ish sort of diet. And so, that's convincing population evidence, natural experiments, really, that plant-based diets, allow us to live longer and healthier.
Absolutely. I happen to have had the privilege of going to the blue zone in Costa Rica.
Yes.
Yes, and their food is just awesome. I mean, the natural food that is being grown, it just tastes so much better. And that people don't understand that usually everybody eats like potatoes, vegetables, a little bit of vegetables, and your meat, and that's it. When you become vegan and plant-based, there is so many more options that you get to try out and savor in your plate.
No, I agree. And my bad for not mentioning Costa Rica, which, aside from Loma Linda, for those of us in North America, is the nearest blue zone to us. And Costa Ricans in general have probably a healthier diet than Norte Americanos on average. It's also shocking and terrible how slightly different example. I'll be brief about this, but when immigrant communities come to America, and so this will be Asian, not a Latin American example, but I was on the medical school faculty in Buffalo, New York, and there's a very large Burmese or Myanmar population in Buffalo. It's where people just happen to go, and every 99.9% of mothers in Myanmar breastfeed their babies. And when I started in practicing on the faculty, within a generation or two, more than half were using formula, and it was entirely like bad American culture. That's been improved now because we're pediatricians and children's hospitals and others are are much and culture is back to breast milk is best and so on. But it's amazing how quickly a change in culture can change diet, and that can be for the good or for the bad. And I would have to say that for um, uh, immigrants coming to the U.S. from global South, the global majority countries, the diet here, the SAD diet, as you say, the Standard American diet, is this tidal wave to manage and try to avoid. Absolutely.
Well, thank you so very much, Dr. Kornberg, for being on the Vegan Pulse. I appreciate it. And I encourage everyone to check out balance.org for resources and more information on how to get healthier.
Thank you, Nancy. It's really a pleasure being here. Thank you for inviting me. I appreciate it.
Thank you. Bye-bye. Thank you for tuning in to the Vegan Pulse, where we have the privilege of sharing the incredible journeys and ongoing efforts of compassionate individuals from all corners of the globe. We hope these stories empower and inspire you to embrace a vegan lifestyle and join the movement towards a more compassionate and sustainable world. Remember, your choices matter, and together we can pulse the vegan movement forward. Keep spreading compassion, advocating for change, and making a positive impact in your own unique way. Stay tuned for more inspiring episodes, and until next time, keep pulsing with compassion. If you have a pulse, you have a purpose. Live vegan.